Having a career in pharmacy can at times feel like an uphill battle. The constant demands, the pressures, and finishing each day like your to-do list was just as large as it was in the morning. It may leave you questioning if there's more to your professional journey. It's a question that I confront regularly, but one that drives me to make positive changes towards a better working life. Daily and weekly reflection exercises has really helped me to understand my approach to working life, what improvements I can make, and what strategies I can use to turn those draining pressures into opportunities for growth. Let's take a moment to reflect on your professional journey and how you approach your goals. What's working well for you, and where do you see areas for improvement? I have seen success with time blocking, weekly meetings with my husband to synchronize schedules, and task batching. These 3 strategies alone have been game changers towards my productivity and efficiency. If this resonates with you and you'd like to explore this even deeper, immerse yourself in my new quiz, What's Holding You Back from Achieving Your Professional Goals? You will discover one specific area to focus on, and hopefully this will kickstart your journey towards a more rewarding career. It only takes 60 seconds to complete, and the link is below. Let me know how you get on. My name is Anisha Patel, and I'm obsessed with all things career development. Whether that's navigating through your professional journey, gaining more clarity, identifying your passions, or gaining the confidence to chase your dreams, I'm here to support you to craft a roadmap to success. I am a pharmacist turned entrepreneur who's transformed my passions into purpose. I've grown a podcast that has reached thousands of people across the globe. I'm building an online business, and I've left my 9-to-5 to chase my dreams and build a career that I love. I've walked this path of transformation myself, and now I'm here to share insights, strategies, and stories to help you carve out a career that you love. Career opportunities, personal development, challenges, growth, and building life skills are all things we discuss on this podcast. Whether you're sipping a cup of coffee, taking a walk, or driving in the car, be prepared to be inspired and motivated to step outside of your comfort zone. This is the Pharmacist Diaries podcast.
First of all, welcome to Pharmacist Diaries, Danny. I'm really excited to have you on the podcast today. I will give you a little bit of an introduction in terms of your journey so people know where we're coming from. So Danny is a wonderful pharmacist with quite a portfolio career. He's been working with over 10 years of experience, starting in community pharmacy and then transitioning into a primary care network role and leading a whole team of pharmacists in a clinical setting, which is really exciting. But alongside that, he's also working as a university lecturer at the University of Brighton. So we have quite a similar pathway in terms of we've got a part clinical role, a part university role, and then recently he was also elected to the Royal Pharmaceutical Society English Pharmacy Board. So we've got so much to kind of catch up on today's episode. I'm really excited to introduce Danny to the podcast, and I guess let's just dive on in. So welcome, Danny.
Thanks, Anisha. Hello. Yeah. Good introduction as well. Sorry, it's a bit wordy, isn't it? But yeah, I think we've got some similarities in our roles, haven't we? Multiple hats.
Yeah, and I love this whole concept of providing variety within your career pathway. And it's something I do talk about a lot on the podcast. It brings me so much joy to be able to work patient-facing in a clinical setting, leading a team in the hospital, working with the next generation of pharmacists from the university side. I've got the podcast here. So I just love doing bits of everything. I love also the fact that you gain so many different skills from the different jobs and they all kind of combine together, or you use different elements of it in different places, which is really nice. And one of the beauties of doing a pharmacy career, really. So let's kickstart today's episode by talking about why you became a pharmacist in the first place.
So I always had a bit of an affinity for science, to be honest. So it wasn't, I wouldn't say it was accidental necessarily, but I definitely kind of had the standard sixth form journey of getting all of the prospectuses from every university, having a whole box of them. And then pharmacy just grabbed me. So I kind of looked at it. I thought I was quite good at science. I thought that would kind of lean into it because I didn't like just chemistry and I like the biology side of it as well. So that's really it. Nothing more fancy than that. And I've loved it ever since, really.
Amazing. And what was the initial kind of first few years of pharmacy like for you when you started in community?
It was okay. I think it's a bit of a baptism of fire, isn't it? You're not trained on any kind of management or anything like that, and all of a sudden you're plonked into a pharmacy to manage a team within a busy pharmacy. And quite a lot of the pharmacies that I ended up managing were really, really busy, quite a lot of items. I think one of the pharmacies I managed towards the end before I transitioned to primary care was 31,000 items a month, which is huge.
Whoa.
It's like a factory rather than the pharmacy.
Yeah, I had a conversation recently about, especially with US pharmacists, because they have drive-throughs for a lot of their pharmacies, and it really takes away from the whole being the heart of community, helping people in terms of the clinical element and the kind of health and well-being side, because people are just coming through that drive-through to pick up medications, and you want it to be a fast process, like going through a McDonald's drive-through. It takes 2 minutes to get through it, and then patients expect the same process within the pharmacy, and they forget that actually we're here as healthcare providers and we have a service that we want to go and give above and beyond just the physical, here's your medication bag and see you later. And sometimes when we're in community pharmacy here in the UK, you are churning out so many prescriptions that you lose sight and you lose touch with the other elements of pharmacy that kind of brought you to where you were in the first place and why you decided to become a pharmacist in the first place. And that can be quite hard to manage, especially if you're newly qualified.
Yeah.
Because you've got so much to be able to do, from understanding the clinical elements, the getting the dispensing right, the checking right, CDs, managing the staff. It's a lot. So I can imagine it felt quite overwhelming. But at the same time, a super good learning curve.
It's great. And I think I saw a variety of different pharmacies. They were run very differently. Each one had different kind of nuances and things like that. So you learn to be adaptable very quickly. And I think that helps. I think going from that sector to primary care, being that adaptable has really helped, but also to make the most of every patient intervention. So as you say, I don't know how they counsel people in America when they're given antibiotics and they've got to tell them to take it on an empty stomach and they're already driving away. That would be quite interesting to find out if you have to yell it through the window. But yeah, so I think making every intervention count and then taking that learning to primary care has been really useful.
So tell me a little bit about, I guess, the point at which you decided to make this career transition and leave community pharmacy. What were your thought processes at the time? What were you looking forward to? What kind of inspired you?
So I think I was very lucky where I was, because the busy pharmacy that I was managing actually was within a surgery, and it was when the primary care networks were forming in 2019. So I already knew the GPs in that practice, and they knew that they were going to form a primary care network with a couple of other GP practices in coastal West Sussex, and they just said, we'd be interested in taking you on as a pharmacist. Would you be interested? And because I already had that pre-existing relationship, it was quite easy to make the decision. But I think the role for me, because it was so new, because you weren't just in one practice, you were going to multiple practices, and kind of taking that learning that I'd had from going to different pharmacies and liking going into different environments and adapting, it kind of fitted all of the boxes that I wanted to kind of achieve there. Plus, I also wanted to become a prescriber, develop a bit more clinically as well. And I just felt that I could access more information in that sector back then, whereas obviously we're in a bit of an environment now where hopefully that's going to change in community pharmacy. But back then we only had the summary care record, so I had to always go next door to the surgery to try and look at more records, more information and things like that.
And I assume you've really enjoyed it so far. What was the specialist area that you decided to do for your prescribing?
When I first started, it's one of those journeys, isn't it? Because it's general practice, you see absolutely everything. But I think when I first started, I've always had a bit of an interest in Parkinson's disease, frailty, and actually deprescribing. I think it's often overlooked, much more of a spotlight on it nowadays. But at the time, I think there was definitely lots of work to be done there. So I chose kind of frailty, prescribing in the elderly and things like that. But since then, it's manifested into a lot of different things now. So I'm very interested in lipids, menopause, lots of opioid deprescribing and things like that. So I think there's a few different hats that I wear in terms of a prescriber now, but initially it was around that frailty cohort.
Yeah, cool. I mean, transitioning from community to this type of PCN role, it makes sense. But at the same time, if you've been a community pharmacist for quite a long time, you're in your comfort zone. You kind of know what you need to do every day. You have a set of tasks that feel comfortable for you. And when you go into this new space, and there's a lot of, like, there's a huge learning curve in terms of your routine, what you're going to set up, building a team of pharmacists to join you. What were your kind of main obstacles or your challenges that you had to face? Like, what did you find quite hard where you thought, okay, I have to take a step back and learn a lot about this so that I can grow and develop in this role?
I think it was just the clinical knowledge, and I know that everyone says that, and it's quite a vague term. So if I try and boil that down more specifically, it was we didn't have a lot of information at our fingertips in community pharmacy, whereas you're going to a sector where you can see discharges, blood results, lots and lots more information than you've ever seen before. So it was around having your own learning of back to basics, really. Can I remember how to read a blood test? Do I know what renal function is good for this medication? And you see more of that patient journey, whereas when you're in the community pharmacy, you're normally at the end of that journey. They've normally had a diagnosis, normally been recommended a treatment and prescribed it, and then you're seeing that prescription. So I think seeing more of the patient journey was a challenge, but really exciting for me, because then I was able to see, well, actually, it's not just one stage of the journey that I can help with here. There's lots and lots of different facets to this. Whether you're a prescriber or a non-prescriber, you can really have interventions quite early on in that patient's condition. And I think that was really appealing to me. But also it was quite scary, because you realise how much you don't know when you have more information, it's great. I thrive on that, really. But I can see how some people, if they get into that sector, it can be a bit overwhelming. So part of my role with any new members of the team is that arm around them approach, where you're making sure that they're not spinning and spiraling out of control, and they're aware of their own kind of limitations.
I'm so glad that you raised that point, because a lot of people kind of go into the skill set of, or bring up the conversation of it's a new experience to kind of build a team, work with the GPs. It's the communication skills, the networking skills. But I have so many community pharmacists who reach out to me through social media and LinkedIn, and they're in community pharmacy, and they find it really challenging to apply for jobs in GP practices, out of fear that they don't have enough clinical knowledge to make that transition, or it's too much competition next to a hospital pharmacist who might apply for that role, and they're way more likely to be hired simply because people believe that a hospital pharmacist has so much more clinical knowledge than someone in the community.
Yeah.
But it's I think it's just all about mindset when it comes to this, is that it's okay to accept that when you're in community pharmacy, the knowledge that you have from university, of course you're using it, but sometimes there are times, because you are so busy doing all the other elements, that your clinical knowledge and the lack of blood results and information on SCR and the discharges from hospital, you don't have access to that information. So you're not utilizing it every single day in the same way that you would in a GP practice or a hospital. But it's there. It's in the back of your head, because you always, as a pharmacist, that knowledge is just hiding, and it's just finding a way to kind of go back and relearn it. And we've all been through pharmacy school before, and we're all capable of getting that learning curve again. And it's just helping people to say that actually it's okay that you don't have that knowledge, or you don't feel like you have that knowledge. We're here to help you and guide you to, kind of excel from the clinical point of view. And I felt like that when I came back from Abu Dhabi. I was in a non-clinical role working in leadership for a few years. I didn't have any patients. I worked in emergency services. All of it was operational. Came back to the NHS and wanted to go back to a patient-facing role, and I felt really uncomfortable. So I decided to go back to my comfort zone. I went back to my Oxford, to where I did my residency. I knew the staff, knew the team, knew the guidelines, knew the ways of working. And I even said to them, hey, I haven't used my clinical knowledge for a while, but this is a great way. Can you put me on emergency admissions where I know I'm going to see everything? And that will help me a couple of days a week to like boost that knowledge again and give me the confidence that I need to say, yes, I can do a patient-facing role again and smash it. So it's really useful that you've brought up that point. And I think there's a lot of people who need to hear that it's okay to not know things. You can learn them again.
I think one of my main tips is get better at reflecting on your own knowledge as well. I think a lot of people will look for someone else to tell them that they don't know something, or to look to someone else to tell them that they're not very good at something and they need to upskill. No one's going to tell you. I think you need to empower yourself to think, right, okay, blood pressure. What do I know? What don't I know? How am I going to forward that knowledge? How am I going to improve that? And I think that reflection is a key to unlocking things. It doesn't matter if someone's applying for a role with me. I want them to be honest and open about what their gaps are and how they've reflected on them, how they've grown on them. So that is really, really important. Doesn't matter what sector you've come from, doesn't matter what experience you've had. If you can reflect on that in a positive way and lead to positive action, then it's going to be a big tick in my book, because I already know that you're going to hit the ground running. No matter what your baseline knowledge is, you know the skills and the resources that you need to kind of increase that. So I think that reflection, we're not all great at it to start with. I certainly had to kind of teach myself to be better at it. Because you don't know what you don't know. It's that Johari's window, isn't it? So I think it's really, really important to do that. As my one tip is to sit down, think about what you're good at, think about what you're bad at, but think about the steps that you need to take to make sure you're getting better at those things that you're not very good at, or the things that you need to improve.
Yeah, no, I love that. It's really great piece of advice. And it kind of leads me to the point in terms of your education and training hat. How did you get involved with working with the University of Brighton? So
I think when I was in my previous PCM role, so I'm in a PCN in Horsham now, but in my first PCM role in coastal West Sussex, I was part of a pilot scheme to take some university students through Health Education England back then. And it was great. I would always welcome taking students, and I enjoyed it so much that I actually kept links with the lecturing and teaching team at Brighton. Then a role came up and they suggested that I apply. And then from that point onwards, I've kind of been involved. So I've been there for a year and a bit now, a year and a half, I think. And yeah, I only managed to do it 1 day a week because I'm doing my clinical role 4 days a week. But I really love it. And I think the degree is changing, and it was the perfect timing for me, really, because they didn't have a huge amount of clinically facing staff in the university. They had people that were kind of full-time academics, and actually having someone like myself that has a foot in both camps was really good. As this degree is changing, I can kind of inform them on what's actually changing on the ground at the same time. So I've loved it, really.
As a pharmacist, I know firsthand how challenging it can be to maintain our health and well-being whilst caring for others. I am a true believer of making the time to look after my physical, mental and emotional health, and I love the idea of using natural supplements to support me on this journey. That's why I was so excited to find The Naked Pharmacy. Their products are 100% plant-based and naturally sourced, 100% biodegradable, and it feels really safe to know that they are formulated, tested and manufactured to the same standard as a pharmaceutical product. However, the most important fact to share is that their CEO and founder, Kevin Levers, is a pharmacist with over 35 years of experience in the pharmaceutical industry. I love that as a community, we can support our pharmacy colleague every time that we purchase a product. As a Pharmacist Diaries listener, you get an exclusive 20% discount off all Naked Pharmacy products using the code PD20. Just visit www.thenakedpharmacy.com and treat yourself to something new.
Yeah, no, I've been really fortunate because Guy's and St Thomas's have academic link posts. That's the post that I was in. So you are contracted through the hospital to work as a clinical pharmacist in whatever specialty. And then 1 or 2 days a week, you will work with King's College London, either on the MPharm course or the postgraduate diploma or the IP. So I've kind of had the opportunity to work on all the courses, but I'm currently with MPharm and loving it. And it's a really good opportunity to see the students in the university setting, and then they all come to placements. at the hospital. So you see them in the practice environment. They get to know you as a lecturer, but they also get to know you as a clinician. And they see you in that working environment, and that link when you're talking and telling stories about what you do in your day-to-day life, they actually see that in reality. And I think that that's really, really useful. But the university pride themselves on the fact that pretty much all of us are working in a clinical setting part-time and then in the university part-time. And they make that kind of a criteria. I think there's only one pharmacist who's full-time at the university, and all the rest of us are either in community GP practice or the hospital, and that link is super valuable.
I think it's really important, and I think what changed when I came on is that they didn't have a huge representation really of any primary care or any general practice pharmacists. So to be able to kind of give that insight, and there's been a few instances, particularly when I first started, of telling the students what it's like to be a GP pharmacist, and their awareness of that just increased exponentially, really. They had no idea what a GP pharmacist did. They had only kind of had exposure to hospital pharmacy and community pharmacy. So opening the door of that and debunking a few myths and things like that was really interesting. I always do a bit of an experiment and ask at the beginning of a lecture how many people are interested in general practice. You normally get a couple of hands that have maybe read a bit about it. And then by the end of the lecture, I ask the same question again. You get lots and lots of people that are like, actually, that sounds really cool. That sounds really interesting. So I think that's really good. I think that's really positive to give more awareness of all of the possibilities when you qualify. But also to be that point of contact if they've got any questions, if they want to go on placement, if they want to do some work experience, being that kind of port of call for them is really good.
Yeah, I mean, it's part and parcel of Pharmacist Diaries being in existence is to allow students, trainee pharmacists, early years pharmacists to understand the types of opportunities that are available to them at their fingertips, whether it's they're listening on Spotify on the way to university, or they're watching the videos on YouTube. You've got this inside information that you would never know or hear about because you wouldn't get exposure to the people that come onto the podcast, and you get so much insight into how people are managing their personal lives versus professional lives. You're hearing the truths behind stress and burnout and how people are managing multiple roles. And also, one important key that I try to focus on a lot is how do people transition into different roles? What skills do you need? What experience do you need as a young person to make sure that when you do apply for that role or you have an interview, that you put yourself in the best position to be awarded that post? And I think it's been 3 years now, and I'm getting so much more feedback from students now about how helpful it's been to hear these journeys, how inspiring it is. A lot of people are messaging saying, actually, I listened to a specific episode and I decided to change jobs. I think that's so cool. I'm so fortunate that I'm in this position to share people's journeys and see people making amazing changes to their career pathways, or giving them that courage to say, actually, you know what, I can do it. So it's really nice to have like you on the episode today, because this whole portfolio pharmacist kind of role or persona is nice for people to see that you can have it all. You can, try different things within the career pathway. You don't have to just go down the one avenue.
Yeah, and I think it's part of that. What do you like in a role? What does your I do a bit of coaching for the Sussex Training Hub, and it's really, what does your ideal week look like? You might not be able to get everything in a week from one role. You might really like teaching, as our example is that you can maybe do a bit of clinical supervision, maybe a bit of teaching in your clinical role, but actually you'll be embroiled quite heavily with your own patients and your own clinical responsibilities. So are you scratching that itch enough in that clinical role to get your teaching up? And do you want to have a role alongside that's going to help that? But what I'd recommend is make sure that they complement each other. Make sure that you've got things that the skills are transferable, because by all means, you could do one job and a completely different job. But actually with pharmacy, there's lots of interlinking skills. There's lots of interlinking things. So I'd have a bit of a brainstorm around what you're not getting enough of that you want more of, and how that can benefit your other role. Because when you're speaking to an organization, if you're full time in a primary care network and you want to do more of a teaching role, start reflecting on what the benefits to that PCN and that GP practice is, because there's been exponential benefits from me doing the university role in that we're going to get a constant stream of students. We have lots of kind of prescribing trainees, whether they're paramedics or PAs that are coming through our organisation, that are then going to benefit from me being in the role of the DPP lead at uni. So I think there's lots of different things that overlap. Look for the overlaps, make your business case as sensibly as you can, because when you are asking to reduce hours, when you are asking to change a role, come with something other than just a request. Come with a request with a reason and things like that. And that's more of the practicalities of getting a portfolio career behind you and developing that.
Yeah, that's really interesting. How have you managed your time in terms of the multiple roles and preventing yourself from going into burnout? Because that's a question that a lot of people ask me as well, is that, you know, we see that you're working at the university, at the hospital, you're a mum of 2 children, and you've got this podcast. How do you manage that? So it's a really good question as I'm speaking to someone else who's in a similar pathway. How do you manage your time?
I think for me, the overlaps, as I mentioned, are really important, because there might be boards that I sit on or things that can link into work streams that are currently involved with my other roles. For example, if I'm doing something to do with policy work through the Royal Pharmaceutical Society, but that actually links in quite nicely with work that we're trying to work on as a network, then actually I'll link those two kind of roles together, and I'll say, does someone from my organisation, for example, want to come with me to a particular presentation with the RPS? Does someone from my organisation want to come with me to the university? So trying to link them together is really important. In terms of my time management, you have to be on it. Make sure that you're not chock-a-blocking yourself with meetings and bookings and things like that, and have a few lines in the sand of, right, okay, I'm going to make sure that I do this amount of work on this day. I'm going to make sure that I have Tuesday afternoons completely free to catch up on all my clinical work. So I think there's an ability to be quite flexible, but don't overdo it. Don't work until 9 p.m. every evening. I turn notifications off. That was one of the best decisions of my life, because I had notifications on emails and Microsoft Teams and things like that. So I think you've got to be quite strict with yourself. When you're off, you're off. But when you're on, make sure you've got a really organized diary. Make sure that every time you're speaking to someone, you're getting maybe 3, 4, or 5 different dates, and you're offering different dates to them. But once you've offered those dates, don't offer the same dates to someone else. It's something so simple, but actually think about how many people you're going to be liaising with. If you've got 3 or 4 organizations you work for, and someone's asked your availability, you send those 4 dates out, but then you get another email from someone else. Actually, they're going to be conflicting, and then all of a sudden you've got to try and fit so much in. So just be aware of what you're doing, what you're sending out, and make sure that you're your best kind of organizer, which has been a learning curve for me. I think mainly because I didn't really have any experience of that. Didn't have an experience of juggling roles and calendars and meetings and things like that.
Yeah, no, I completely understand. And it is tough. People who go into like split posts that I've seen at GSTT, especially in the early stages, it's quite hard. Are you strict with regards to what hat you've got on each day? So do you have your one day at university where you do nothing related to your clinical role, and then on your clinical roles, do you not open up your emails for the university?
That's a difficult question. It's $1 million question. I think when I'm actively teaching at university, absolutely, that's 100%. Will not look at anything else. Won't have any clinical hat or anything like that. But with the university role, when you're not actively teaching, you're kind of developing lecture material and things like that, I will have my NHS mail open. But if I am aware that that's distracting me too much, or if I'm aware that that's taking too much of my resource and I just need to knuckle down and develop some lectures, then I will just shut my emails off. So I think it's a mix, really. It will depend on what I'm doing, how much it's taking from me. The other thing to bear in mind is that I'm part of a team. So I lead a team of pharmacists and pharmacy technicians, and part of my role is to have complete oversight of all of the practices in my PCN to make sure everywhere's not falling behind and everyone's kind of getting on okay. There aren't any learning needs or anything like that. So I have a good idea before I go to university on a Friday what that kind of landscape looks like. So the reason that I chose my university day to be a Friday is that I can kind of set things up to be able to give myself time on a Friday. So yeah, and that's a really important kind of thing, is that if you are thinking about taking a role or another hat or spin another plate or whatever way you want to phrase it, think about what your current week looks like, where are your pinch points, and where does that second role fit into that? Because if you try and juggle too many things in a really busy period of the week, then that's going to be even more troublesome, I think, in the long run.
It's tough. I was doing Tuesday, Wednesdays at the university and Monday, Thursday, Friday at the hospital. And it's quite tough. Mondays, it's really useful to be at the hospital because obviously you get like an influx of patients, usually over the weekend, that haven't all been seen. So if you're on a ward, then it's usually very busy on a Monday. So it's nice to be with the team to be able to support the kind of clinical side of ward work. But then you have to turn that off and go into university mode Tuesday, Wednesday, by which time, because I'm working in palliative care, there may be symptom management plans that were coming through on the Tuesday, Wednesdays. And I didn't have anyone else within the palliative care team that could support me with that. So a lot of the time I would be just hopping onto the email to see if any of those urgent emails were coming through. And my team would actually just message me and just say, hey, we had like a traffic light system in terms of red, amber, green as to when the SMPs needed to be done. So if there was an urgent, this is literally 24 hours, needs to be turned around, then of course I would drop things in terms of my university work, with the exception of teaching, and get that symptom management plan done. Eventually I got to the point where I supported education and training to our band 7 pharmacists. So if I wasn't around, somebody else could potentially screen those prescriptions. So again, that support piece came in, and that was really useful if I wasn't around to help, especially with annual leave as well. It was really tough. And then you kind of go back into Thursday, Friday clinical mode. I now have switched that, similar to you, where I'm doing Thursday, Fridays at the university. And initially it was really tough to do Thursday, Fridays because most of the IP teaching was on Tuesdays. And then we had to split the team because everyone's part-time, that some of us would be around Mondays, some Wednesdays, some Thursdays, some Fridays. So we were trying to have someone available at all days of the week, which made it difficult to just choose whatever days that you wanted. But the Thursday, Friday is perfect for me because, like you said, you can plan your week and get things done that are urgent for patient-facing or your team in the clinical environment. And then you know that you're kind of free to focus on the university side Thursday, Friday, which is really, really helpful. So I like that you had a strategy in terms of managing your time and choosing the right days to be able to teach. And I think that's really valuable to showcase to people that you can build the week of your dreams. You can build the week that works for you. You can build the opportunities that support you to be motivated and inspired in your job as well.
Absolutely. I think you just need to have a think yourself of what your perfect week looks like, have an idea of that, and then kind of start to logistically think how that works with the organizations that you're hoping to be involved with and that you're currently involved with. I think the further you go in that, the more of a leadership role you become. My experience has been that the danger is you become too far removed from the coalface, so to speak. So you end up not knowing what the current situation in each practice is. And the way that I manage that is that I have the golden threads of senior members of my team that can feed back to me if there's anything on the ground that is changing that I didn't think was changing, but is changing all of a sudden. So like your example of maybe a last minute care plan that's coming in, if there is a massive influx of workload in one of the particular practices, then that golden thread of that kind of senior pharmacist will feed that back to me and I'll be able to react to that. So making sure you've got the construction in your team to enable that. If you're in a leadership role, if you're not in a leadership role, then what will you disappearing for a day? How will that affect the other people within your team? And how would you manage that? And I think that knowing the ripples that you're going to create and how to manage that's really important as well. So it's not just a case of, I want to do this because I want my perfect week. It's, I want to do this. This is my dream. I want to do more teaching. I want to do this. I want to do that. It will affect my team in this way, and this is how we're going to manage it. And that's the way that you get things over the line a lot more constructively with any organization that you're trying to work with or trying to negotiate a different weekly plan with.
Picture this, you're juggling multiple prescriptions, patient consultations, and endless hours of administrative tasks, all while maintaining a happy work-life balance. It's chaotic, it's stressful, and it's downright exhausting. Or maybe you're a student who's overwhelmed by all your assignments, exams, OSCEs, whilst attending hours and hours of lectures and labs and maintaining an active social life. What if I told you there's a way to streamline your week and reclaim a sense of control over your time? I think I can kickstart that journey. I've created a free PDF guide, 5 steps to streamline your week and add 5 hours to your schedule. In this guide, you'll learn how to optimize your workflow, prioritize your tasks, and carve out precious time for self-care and personal pursuits. Click the link below to grab the guide now. I promise you your future self will thank you for it.
And negotiation is hard.
It's hard.
It's not easy, and you've got to try it. You've got to actually kind of face those fears in terms of giving it a go. And if it doesn't work the first time, accept it and be okay with it, but also ask whoever you're speaking to, or the chief pharmacist or the manager that you're kind of requesting this split role from, what could you do to improve in terms of the next time that you ask for something, or how could we work around it so that I can, 6 months from now, potentially reconsider another opportunity or a split post as well. Getting that feedback is really, really useful if you're kind of struggling with the negotiation piece, because it is challenging, especially for the younger generation. It's not something that we really teach in the MPharm course. There's not that much space to go in, diving deep into some of these discussions. So it's part of kind of the experience of being a pharmacist, and you kind of learn on the go.
But I also think it will develop yourself as a leader as well. If you're putting yourself in your line manager's shoes and the people that are in your team, put yourself in their shoes and think about what those repercussions are going to be. Think about what their current experience of the team is, managing that team, and have an open dialogue about it. I would love someone to come to me if they want to change any of their weekly plans. My first question will be like, well, what effect do you think that will have? I know probably what effect that will have, but I want to know that they're reflecting on it themselves. They've already thought about that, and they know the implications of that. They know that if they're going to take an extra day of the week off, that's going to cause the days that they are working to be a bit more busy. And how are they going to manage that? Are they going to burn themselves out by removing a day of the week because their Wednesday, Thursday is going to be a lot more busy? So I like that reflection, but it's not up to us necessarily to say that to you. I want you to think about what those ripples are. And I think that makes you develop as a leader, because when you are eventually in those leadership posts, you're going to be looking at that and thinking, actually, this is going to affect X, Y, and Z because of this. So it's a really good tip, is to just take a step back and think about the effects and the ripples that it's going to have on the organization.
We at the hospital, we were always encouraging our juniors to get involved with some of the senior meetings so they could see the other side. Even with the rotas, get involved with building the team rota so you can see some of the challenges that we face building ward cover and dispensary cover and sicknesses and annual leave, and also support with getting involved with who gets annual leave and when, and approval, so that you can understand the concept behind some of the decisions that are made within the pharmacy team, and those kind of minimum staffing levels that we need, and things like that you don't necessarily have exposure to as a junior kind of clinical pharmacist as well.
I think it's transparent leadership is so vital, really, isn't it? And I think that at no point, I often make a joke that I want everyone to take my job so I can retire and go away to the Bahamas. I think that's really important, that everyone knows why I make decisions, knows exactly what decisions are made around the organization, around the team, and wider than that. And I think that giving them that insight is going to be value in the long run, whether they want to develop as a leader or not. Actually, that transparency can really help kind of cohesively for a team.
Do you have any specific strategies with regards to that? Do you have team meetings every week where things like this come up?
Absolutely. So we have a team meeting every Thursday morning, and it's virtual because we've got 4 practices in my PCN. Some people are working from home 1 day a week. So Thursdays is our only overlap day because we've got some part-time staff. So we do it virtually. I try and do a face-to-face one every now and again, just so we remember what each other looks like, and we've all got slightly older by the next time we see each other. And then I think that's really important, just as a touching base. How's your week been? What's been going on? But any updates from me? Are we getting a trainee or something like that? And then I think, other than that, the golden threads that I alluded to, having those senior members in your team that can kind of liaise with other people and feedback to you is really important. So we'll have those team meetings, but maybe I'll have more frequent meetings with the senior people in my team who can feedback other things and other things that are changing. And then as an organisation, we very much want ground up working, and we very much want all of our teams to interlink. It's not just the pharmacy team and then that's it. So we have a line managers meeting every Thursday, so it's after my team meeting, which is quite convenient. And we have a lead pharmacist, lead social prescriber, lead care coordinator, our clinical director, clinical operations lead, and the PCM management team. And we all meet together, and everyone's feeding back into what their team's experiencing, what the kind of pitfalls are, what is the experience of the team, the problems they're having, and then we kind of, as a group, solve it. And actually, that's really, really helpful, because there's things that I may not have thought of and solutions that I might not have thought of, but one of the other leads has experienced this issue before, and we talk through it together. So I think it's really good to have a good mix of those types of meetings. I don't like death by meetings. You don't want a meeting every day, 4 hours a day. They need to be proactive and they need to be fast. I don't like long-winded meetings for no reason. So they have to be agendaed. There has to be a reason behind it, and everyone has to have an equal voice. So I often try not to speak first. I try and say, how's everyone going? And then I kind of sit back and hope people speak, because I think the quieter voices sometimes struggle in that type of environment.
That sounds really good, and I like that. And is it a non-negotiable, this meeting for you? Every week it happens. As many people that can turn up should turn up. There's an expectation, but obviously if you can't for whatever reason, it's okay.
Yeah.
When you have that agenda, what are the kind of highlights within the agenda? Not the specific details, but are there kind of key points that kind of come up? And how do you follow up on the actions that come out of that meeting?
It's a great question. So I think you split it into two different things, really. I think there's operational things. So what's happening in the organisation? Are there new members of staff that need help in their induction? Do we need people shadowing? Am I having new trainees coming on? Am I trying to get more trainees? Which is often the case that I talk about. And then I think, from a clinical point of view, what practices are struggling at the moment? Why are they struggling? Is there a particular trend of patients that they're seeing in each practice? And the actions that come from that will vary. So let's say, for example, there's lots of blood pressure patients that are presenting in one practice, and that's taking quite a lot of our resource. Then how do we manage that? How do we make sure that we're risk stratifying them to make sure we're dealing with the ones that are the most at risk first? And that action might be something like, I'll have a meeting with one of the senior pharmacists and we'll look at the data. I might have a meeting with the pharmacy technicians and talk a bit more in depth about that. So I think it does vary. We make sure that the actions are done based on what the issue is. But I don't like necessarily minuting meetings for the sake of minuting them. But if there's an action that's really important that will lead to an email or that will lead to a protocol getting developed, I very much like putting that in an email as soon as that's happened in the meeting. So I can remember it happened, and B, that we've got kind of a record of that.
Yeah, because you can fall into the trap. I mean, I've worked in the NHS for quite a few years, and sometimes I feel like I attend meetings and there's a whole bunch of talking, a whole bunch of not complaining, but issues that are coming up. So people are explaining what the problems are. We might talk about the solutions within the meeting or ideas as to how those problems can be fixed. But when it comes to action, sometimes that action is never taken, or it's not followed up, or you're supposed to have a meeting 2 weeks later, but it gets cancelled because of clinical priorities. And when I was working directly in the NHS every single day, this was quite frustrating for me, because I'd be part of a team, but I'd never kind of see the progress. And so the only reason I'm asking that question is because I'm looking to see if other people have strategies that work. How do you hold your team accountable for those actions? Or is it that you've created this really nice team environment where there are values and priorities and people feel like they've got purpose, where they genuinely feel motivated to make those changes for the patients or for the team because you're so well gelled?
I think so, and that can change over time, right? So I think people will have lots of impetus, and will feel valued and will feel like they're really making a difference. And sometimes that will fluctuate, and sometimes they might not feel like that. I think the way that we manage that in my team is that we have a team charter, we have our values that we adhere to. We all come together to do this charter. If there's a new member of staff, then we do a new charter and we talk about what our values are, what we want to achieve as a team, and how we link that in together. And we kind of have that in the back of our minds, and I know my team do as well. But also everyone has their own kind of individual journey of what they want to do, how they want to develop, what makes them tick, because some people really like audits, some people really hate audits, myself included. Like building the searches, but actually an audit is actually not what gets me going. Talking to patients is. So finding out what makes each individual tick is really important, but the awareness of what makes the individuals tick is really important. So if I know that a member of staff really likes doing audits, then I'm going to be leaning on them if there's an audit that comes across. But if I don't know that, then there's no connection there. So I think part of the reason I developed this thing where I have a 3-hour meeting once every 6 months with each of my team, as well as their monthly one-to-ones. And that's really, I called it a competency cafe. And that's really for me sitting in a room with them for a really long period of time. Don't worry, they have tea and coffee available. They don't have to lock themselves in a room with me. But it's for me to find out what makes them tick. What are they experiencing at the moment? What are they encountering at the moment? How do they feel about that? How confident do they feel about that? Can they link in with other teams? Do they know other teams in the organization? How even to link in with them? Do they know what a social prescriber is? Do they know how to refer into them? And then what do they want to develop on? And like we talked about earlier, what's their ideal week? How do we want to build that ideal week? And what I've noticed, and I've done these meetings with all of my team, is that their ideal week is very, very closely matched to what they're encountering on a day-to-day basis, which is great. That's what I like. That's what I want to see. But there might be a couple of things that they're not encountering that they'd like to do a bit more of. And that's what I now have as information, that if I have a project that comes across my desk that has that ticks that box for that member of staff, I can be like, I've got a perfect person for this. This is great. And I can hand that to them. I think one of the best bits of advice that I've ever been given is that you don't see results the further more removed you are. The more in a leadership role you are, you might not see results there and then. And you just have to be okay with that. You might not get that immediate feedback if something's working. You might not get that. But if you know that you've got all of the bones and the structures in, you have to trust that that will happen. So you might have things where you can see the goal, you can see the outcome, and you see that full circle. But actually, the more removed you are, the more members of staff you have, the less likely you are going to see absolutely every little bit of minutia in that detail. And that's okay. Be okay with that, because otherwise you end up in a double-edged sword of micromanaging. You feel like you want to know everything because you used to know everything and now you don't know as much, but you have to trust that. I think that uncomfortableness as a leader is really stepping back and hoping that the recognition and the results will come.
Oh, that was so good. And it makes so much sense. It feels like it's so much common sense what you're doing. And I love that you are looking at individuals and their skills. And it comes back to the reflection piece, doesn't it? You're getting your team to understand more about themselves, what they're good at, what they're not good at, and where they need to, build the gap or close the gap.
Yeah.
And kind of make those improvements. And if someone's really good and passionate at something specific, like audits, you're honing in on that and helping them to experience that, more often. And this is how teams get built. But it doesn't always feel like this in roles. So I love that you've created this environment, and how lucky is your team to have you as a leader. And also your trainees, like how exciting for students and trainees who are coming through your doors, because you are demonstrating so many skills that they will learn from, like even being in those meetings and seeing those ideas, hearing the concepts, seeing what other people are doing is going to inspire and motivate them to grow. And I love that.
I think it's important. I think I want everyone to be happy in their role. I think we have to be aware that you're not going to enjoy a lot of what you perhaps encounter on a day-to-day basis. It doesn't get you going, but you still have to do it. The work's still there. But how can I facilitate the times when I can give you things that you do enjoy, and there are projects that you can be involved with on top of the work that needs to happen? there's no reason that I wouldn't do that. There's no reason that I wouldn't want to do that, because I want you to enjoy what you're doing and I want you to feel like you're progressing and you're not staying still and things like that. And certain people, what I will say is certain people, the uncomfortable, living in the uncomfortable, pushing that barrier of what they have been told in the past of what their role can do and the limitations of their role, me kind of debunking that and telling them that their role is a lot more than that and they can achieve quite a lot more than that. And actually there's lots more facets to their role that perhaps they've never been aware of. I think that's really important to do. We have to push the boundaries, because I always reflect on pharmacy technicians as this cohort, because pharmacy technicians are just doing more and more, and they want to be doing more and more. It's really uncomfortable to do that. As pharmacists, if you would have said pharmacists were going to be prescribers 10, 15 years ago, someone would have looked at you like a lunatic, whereas now we're prescribers. So I think we have to move with the times. We have to develop. Everyone's on a forward journey. No one's going to stay completely still, and that's okay. It's okay to feel uncomfortable with that, but don't panic with that uncomfortableness. Grab it with both hands and think, well, great, but I need to do this, this, and this to be able to feel more comfortable with it.
Yeah, no, I love that. And that kind of helps us to transition onto the topic of pharmacy students becoming prescribers at the end of the course. And what have you seen so far in terms of that shift at the university? Because my experience so far is that I have this discussion at the beginning of lectures or workshops, and just to get people's kind of perception of how it feels to now know that when you're finishing university, you are a prescriber, and that responsibility and what you're expected to do is very different to what you came in to the course initially expecting. What kind of feedback have you been receiving from students in terms of the excitement or the anxiety, or
I think it's
anything in between?
Yeah, I think it's quite a lot of people are probably quite anxious about it. Quite a lot of the feedback from students have been, I wouldn't feel comfortable doing this. I wouldn't feel comfortable signing this prescription. But when I press them a bit more is, why don't you feel comfortable about this? Why do you think that this wouldn't be? Why do you not feel safe prescribing this particular type of medication? Is it because there's a learning gap there? And if there is a learning gap there, then would you feel more comfortable if you didn't have that learning gap and you were able to bridge that? And they're normally kind of from the start of a lecture, like you say, from the start of a workshop to the end of the workshop, I'll have absolutely no one confident on prescribing. And then by the end of a workshop, I'll say, do people feel a bit more comfortable with that? Do people feel that they can approach this in a bit more of a logical way? And all of them kind of tend to feedback yes. So I think my feeling is that there's a lot of work to be done. Good supervision is really key here. I think that we're moving into if you think about supervising a prescribing trainee at the moment, is probably someone that's got some lived experience of being a registered pharmacist, whereas we're going to people that have no lived experience of being a registered pharmacist and would have just been a trainee. So the supervision model has to change with that. We have to adapt to that. And actually their supervisional needs will be a lot different to that pharmacist that has had some lived experience of being a pharmacist. Maybe they need a bit more information, knowing their own limitations. Maybe you need to have a different kind of supervision model for them. But what I feel is I feel really excited about it. I want everyone to feel safe and I want everyone to feel supported, but they need to know what that support is for them. I would like anyone that I supervise, I ask them what type of feedback they like. How do they want to be supervised? What would be the most proactive way for us to do a session together? Is it me sitting behind them and listening to them on phone calls? Or is it them listening to me doing a couple of phone calls with a patient and then having a bit of a debrief after? Because everyone learns in a different way. So I think with this new prescribing cohort that we're going to get, and we're going to get lots and lots of prescribing ready trainees, they're not going to be prescribing ready out of the door, although they technically are. We need to have that learning needs assessment from that point that they come through the door and develop a bit of a management and a personal development plan for them. I think that's really key. But it's exciting. It's my main overriding feeling. Was initially fear, now very exciting.
Yeah, no, 100%. And it's a huge learning curve for all of us, and gearing them up to be ready for this is it is exciting to be part of that journey, because it's a massive change for pharmacy. And working with MPharm at the moment and navigating that change and implementing small steps within the course, within workshops, within dispensing classes to shift that mindset for our students has been really fun. You know, like when we have dispensing classes now, Obviously, we used to focus on labeling and dispensing and elements of accuracy checking as well. But now we're also getting the students to actually complete prescriptions. How would you actually write this? What are the legal requirements? You're putting pen to paper and signing it. And just that shift in mindset has been really enjoyable to see. And the students are actually, I think they're really enjoying it as time goes by. We've got these simulation classes that have been really fun to teach, but also the students are really getting into the whole kind of mindset of diagnosis. Like, what information do I need to know before I make that decision to put pen to paper? And I know we say pen to paper because in our simulation classes, we're in a room where we're not using computers. So we obviously have paper prescriptions.
That sounds nice.
Yeah, it's cool. But obviously in reality, most of the time it's electronic and we make them aware of that. But it's really nice to actually physically write on an FP10 for them, because they've got to get all of those legal requirements set in stone and remember those along the journey as well. So I have enjoyed the process so far. I'm looking forward to kind of seeing how 2024 pans out in terms of the progress that we make with our students and that kind of shift in mindset, and also their abilities and their experience is going to change. And we've done a lot of work with regards to placements as well, and what they actually see when they're on placement. So when they're going into hospital or GP practices, we're getting them so much more involved in observations. So they're working alongside nurses to take observations, to understand what the observations mean, like doing all their news scores and things like that. We are getting them to do medical histories with doctors during admission, and that shift has been quite different because they're experiencing so many different skills as well. So I've really enjoyed hearing the feedback from students over the last couple of months to see that kind of shift. I don't know if you've experienced a similar journey with the University of Brighton.
Yeah, so at Brighton we've got a similar kind of model in terms of the simulated pharmacy, but what I really was keen to get the pharmacy students to see is what it's like to be in a consultation and what different types of consultation you have. So we have a telephone consultation workshop where a lecturer will be at the other end of the phone and they get used to ringing us, and we're a difficult patient, we're not an easy one. And I think that's really important because actually the landscape of being a pharmacist, particularly in general practice, has changed now. There's lots of pharmacists that work exclusively on telephone consultations and don't work in a face-to-face capacity, whereas the old degree, you would only kind of get a face-to-face way of managing patients. So that's been really interesting. They've really engaged with that. I think I was very nervous before their telephone consultations, but I gave them a bit of a preamble workshop before so they knew what to expect. The other thing I think is really important that we're trying to drill into them is that the follow-up. You're not handing this person over and forgetting about it. You're initiating a med, or you're titrating a medicine upwards. How are you following this patient up? How long are you going to wait to follow that patient up, and why? What's your reason for that? Are you going to follow them up every week because you're worried that you've prescribed the wrong thing? What's the reason behind that? Is that good for the patient? You're going to get the patient to come in every week? What's the practicalities of that? So really getting them into the mindset of, you're initiating this medication. What do you think is a sensible time for follow-up? And what I use a phrase, living in the grey, quite a lot, because I think as pharmacists, we're very used to black and white. We love it. If something's in the BNF and it's a dosage license in the BNF, we're so happy. If it's not a licensed dosage, oh my God, alarm bells. What on earth am I going to do? I think living in the grey is really important, particularly when you're a prescriber, because you're not going to have a perfect patient that sits in all guidelines. You're going to have a patient where you have to make those decisions that maybe slip outside of a guideline or slip between guidelines, or maybe you're recommending a second line product because the first line product you don't think is appropriate for them for whatever reason. And I think that mindset change has been really, really interesting, because you can see that, not panic, but you can see that uncomfortableness. And managing that with yourself is really important, but also managing their expectations that at the point of registration, all of them are going to be practicing differently to one another. Everyone's going to be prescribing. One prescriber is not the same as another. I'm sure that me and you prescribe completely differently. We prescribe within our own right, but we're comfortable with that. When you make a prescription, you know that you're prescribing this for a reason. You've evidenced it, you've put it in the notes. And if someone was to ask you why you prescribed that particular agent, you can evidence why you did that. So getting them used to doing that is really important, rather than just handing this person off and being like, okay, not my problem anymore.
Absolutely. And we do a lot of that now in our simulation labs, and it's really interesting to see the feedback that you get from students. But the more and more cases we put them through, the more and more that they are gaining that confidence to say, yes, actually, this is something that I need to follow up within a few days, or actually, no, that's fine. We can give it a month before we see them again. But having that awareness that you need to do the follow up and the monitoring, and that is part and parcel of the responsibility of writing a prescription is really key in this process. Let me take you, I guess, to the point where you have been awarded an amazing opportunity of being on the RPS English board. What was your motivation behind that? I'm curious to know anyways.
I've always been interested of what happens at the RPS and be on the inner sanctum, if you like. I like the RPS for the resources they offer. I think that as a professional leadership body, they've always been very, very strong at being a figurehead for our profession. And I really like some of the support that they've given me when I've not known the answer to something, when I've wanted to develop as a prescriber or develop as a DPP. They've got the guidelines there. So when the elections came up, I don't know what made me apply. Truthfully, I don't. But I just thought I'll give it a go. I never in a million years thought I'd get elected. So I would like to say that I applied for it because I was interested in what a board member did. But truth be told, I didn't know what the role of the board member would be until I actually got my feet under the table. And it's been so insightful. So if I talk about my other roles, and very clinical heavy, very educational heavy, whereas the RPS is very policy based. So you see the wider view of, okay, well, this is happening. How does that affect the whole profession? Not how does that affect one sector of the profession? How does it affect everyone? And that's been amazing. And we've had people from the government come in and speak to us at board meetings and things like that. So seeing a policy level decision making and deciding as an organisation what we want to target, how we're going to support the profession even more, has been amazing. It's been great. And I was lucky enough to get elected for 3 years. So I've got another two and a bit, I think May, I can't remember now, May 2026 or something. But I'll probably stand again. I think it's really, really important that we have people that are passionate about pharmacy sitting on the board, but also people that have experience of multiple sectors. And I think at the moment, the RPS board has got a very, very good makeup. All of my kind of fellow board members represent all of the different sectors of pharmacy. So we haven't just got one voice. We haven't just got one sector. So if something is happening in the pharmacy landscape, and that's being filtered down from the government or the chief pharmaceutical officers, we've got enough people around the table to know exactly what the impact's going to be across all of the environment of our profession, which I think is really valuable and something that we need to make sure that we make the most of.
I'm really glad you've been enjoying it. That's really exciting. And you've probably been gaining a lot of kind of new skills and exposure, and that kind of really high level overview of what's happening in pharmacy is really interesting. That insight must be an enjoyable, kind of team working as well, networking with new people and kind of being part of that leadership journey. So, I wish you all the best for that. It sounds like you're enjoying the journey. What does 2024 hold for you, Danny? What are the exciting things that are happening, except that's one huge thing.
Yeah.
But what other things are going on that you could share?
Just lots more education, really. So I started speaking at a few events last year, which I really enjoyed, around kind of clinical areas that I'm particularly interested in, and just pharmacy in general, really. So I think this year I'll be doing that quite frequently, making sure that there's more networking opportunities, more opportunities for me to meet peers in conferences and things like that. I'd encourage anyone that is interested in going to conferences. I won't name a particular one, but all of them, any opportunity you have to network with colleagues and learn, take it with both hands. I think that's really, really important. So more of that, definitely. Other than that, I think there's been a really exciting announcement with trainee pharmacists, not from this year, but from next year, 25-26, we'll be able to have GP practices and PCNs as the lead employer. So developing a roadmap really for trainee pharmacists to have us to be in general practice as their main employment, I think is really exciting. So this year is really about spreading the word on that, getting as many PCNs excited to take as many trainees as they want, as they can, because I think that's going to produce the most well-rounded pharmacists, I think, in the current landscape, whilst we're waiting for Pharmacy First to get properly up and going in community pharmacy. I think a bigger stint in general practice and PCNs with a very well organised placements to hospital, mental health trusts and community pharmacies. I think a big 9-month stint in general practice and being mainly contracted to us will produce amazing pharmacists. So I'm really excited about that. So developing that kind of program for my organisation and sharing that and hopefully convincing a lot more PCNs to do that is part of my plan for this year.
The negotiation piece comes back into
a lot of negotiation. My life is negotiating a lot of things nowadays.
It's exciting though. That is so cool. Do you actually know what the stats are at the moment with regards to the percentage of kind of trainees that go hospital, community, industry? Do you have any idea?
I don't. So there's figures in Sussex that I don't know the exact numbers, but I definitely know that there weren't many places that were particularly filled in community pharmacy. But we want to increase that. I think across the country, we want to increase any place that is offering a pre-reg place. We want them to have a pre-reg place with them. We don't want someone that really wants a pre-reg to not get one. I keep saying pre-reg. I do mean trainee pharmacist, but I'm really struggling to get that to get that habit out. So what I think this enables us to do is unburden community pharmacy. When community pharmacy want to take a trainee pharmacist, but they don't know how they're going to upskill this newly prescribing pharmacist and be a DPP for them and be able to have that prescribing supervision. What this new kind of announcement enables us to do is it enables us to take that supervisional burden off of the community pharmacy. So we can still give a community pharmacy a trainee pharmacist, but actually we'll do the prescribing supervision. We'll do the bulk of that, whereas they can concentrate on the things that they're encountering in community pharmacy. They're encountering all of the dispensary management, the over-the-counter, the minor ailments, and all of those amazing services. And it means that they've got more of a focused experience of what it's like to have a pre-reg rather than kind of running around like a headless chicken wondering who's going to supervise who. And that's what's really exciting to me. So my goal, and I think everyone's goal, is anyone that should take a pre-reg or wants to take a pre-reg, get your applications in by the 1st of March for 25-26. Make sure you've got a really well-rounded program. And yeah, that's my kind of sales pitch to everyone, really.
Amazing. I love it. And that's a great way to kind of end today's podcast episode. We've talked about so many good topics today, a lot of skills, a lot of reflection, looking at negotiation skills, but also, it's been really nice to hear your journey and everything that you've been getting up to date. So I guess watch this space for 2024 for Danny. And I know you are quite active on LinkedIn. Is the main place that you're active?
Yeah, pretty much. I can't deal with more than one social media, really, to be honest. So
fair enough. I feel you. It is hard.
I don't know how you do it.
All of the platforms. It's tough.
Yeah.
I have to be really strict with scheduling posts so that they come out on their own, which is tough. But at least I have purpose in terms of it's a podcast episode. I kind of know that it's, marketing that particular person or that episode. So it can be done with time, and this whole batch recording that I'm doing helps with that process. So I will make sure that I share your LinkedIn profile with people on the show notes, and if anyone wants to reach out to you, then they can connect with you through LinkedIn.
Absolutely.
But thank you so much for your time, your energy, and all the kind of amazing information that came out of this episode and your journey. I really genuinely appreciate that.
You're welcome. It's been great. Thank you very much.